My name is Ryan.
I'm Jeanette.
And I'm AJ.
Today we're going to be talking about a problem in nursing, which is communication. To start off with, we'll be going over communication in nursing with delegation to assistive personnel, such as your unlicensed assistive personnel, your patient care tech, your CNA, depending on where you work. One of the problems is clear delegation. What can you delegate safely? What is in their scope of practice and what is in their individual scope of practice? Not all techs are created equal. Some have been trained to remove Foleys, some have not yet. All depends. Getting to know your tech and getting to know what their skills are, what they're comfortable with, is key to having very good teamwork and in return, very good patient care. One of the other things is timely delegation. Every tech can help you with a turn, but delegating it at the end of the shift when they already have 15 different things to do is not really the most conducive use of their time or our time. Having a good communication like, hey, every 2 hours on the dot, we'll meet up in this room, we're going to turn patient 405. What all these can lead to, if we don't do them, is less than optimal results, such as a DVT, pressure ulcers, or CODIs. Overall, that leads to less patient satisfaction. One of the ways we can improve upon this and achieve our goals of helping the patient and getting them out of the hospital quicker and improving their stay is clear communication. Give them a task with a time frame. Hey, I would like you to be able to do this before 10 o'clock. And follow up with them. Make sure it got charted correctly, and also make sure it was done to standard. Or see if they need any help. Sometimes your tech will get overwhelmed. You're not the only nurse on the floor. Being able to help them like, hey, I got this some time, let's go take care of this bath together and get you caught up on your tasks. That way you have that teamwork aspect and you have less burnout overall. Also, sometimes plan of care changes. Somebody that you wanted them to walk with, hey, can you ambulate this patient 3 times today? Maybe they turn into a 2-person assist because they're a little bit weaker. Being able to adjust your course and help them is key as well. Some of the ways to help achieve this, having an in-service with your patient care techs, knowing what they can accomplish and improving upon that. When they start out, they might not know a lot. This might be their first job in healthcare, or they may have been around for 20 years. But having it in services so you know what they can do and improving upon it and making sure it fits to the standard of your unit. Also, setting that appropriate task so that they're manageable and don't feel overwhelmed. All of these things will achieve clear delegation, teamwork, the follow-up, which lead to meeting your patient's needs and also helping promote patient safety. At the end of the day, the goal is to help make the patient stay better and safer. You never want to have a fall on the unit. You never want somebody to suffer a CODI. All these things, having that clear communication are key. Thank you.
Okay, so communication is crucial to achieving the best patient-centered care that we can provide. This is going to be dictated by the nurse, the patient, and whatever the situation is. Communication obviously is verbal as one aspect of it. We need to be able to assess the patient to learn the best way that they can understand. Perhaps a good way to do that would be during admission of your patient, that you use that time to learn that information so that you are actually bundling your workload and having better time management. At the same time, you're able to communicate better with your patient. The level of education of the patient is going to be another factor in the communication, because you need to know the best way to help them learn anything. Whatever you're going to need to teach them as far as their patient care when they leave, such as pain medication administration and the side effects, or wound care. Okay. So possibly a good idea there would be to always use simple and concise wording with the patient and have the patient talk back to you about whatever subject you were talking about to ensure that they had a full understanding of what you were saying to them. Counseling is another educational tool that you could do, provide support groups for the patients for furthering their care when they leave the facility. Nonverbal is another aspect of communication. Patients are going to be able to read your hand gestures, your face expressions, and that can say more to the patient than when you actually say something verbally. So we want to make sure that we're actively listening, and we can portray this by having an open body facing the patient, having good eye contact with them. But with the eye contact, we need to be in context of the culture too, to make sure that we're not overstepping our bounds and making them feel uncomfortable. So be aware of that. The other way we're going to communicate is by situation. It's been found that when nurses have fewer patients and they're less stressed, that the care and the communication to the patient is better. So time is a huge factor or a huge situation that can make the communication between the patient and the nurse not very good. And if the nurse is overwhelmed and just with their workload and stuff, it can be perceived by the patient that they are not getting the nurse's full attention and that they are not being heard by the nurse. This can lead the patient to feel neglected by the nurse. So this would be a good time to really make sure that those delegation skills with your assistive personnel or a fellow nurse if need be in play, because this will ensure the nurse has more time to take care of her actual nursing skills, which will therefore facilitate better communication and time spent with each patient individually. So nurses have been found that if they have been on the floor for an extended period of time, that they are better communicators with the patients. They have more understanding of how to communicate with the patients from having different scenarios that they've had to endure. And they've also had more time to have more training on how to communicate with the patients. So one aspect of new nurses should probably be that there is more availability of learning communication skills through educational tools or seminars or whatever in order to accelerate their learning on how to communicate with the patients so that they can be up to speed more quickly on that. Because without effective communication, the patient is not going to be satisfied with their care.
So when a patient becomes admitted to the hospital, there are a lot of specialties that have access to the patient's chart. From admission up to discharge, the patient's chart is seen by nurses, doctors, PT, OT, different types of specialty. So communication is crucial. Today I'm going to speak to you about interpersonal professional communications. Specifically, however, I am going to speak to you about providers and nurses. So there are a lot of communication styles when it comes to in the healthcare setting. First of all, nurses tend to be more highly descriptive and more detailed. Doctors, on the other hand, are brief yet still very clear. So right there is sometimes that causes discrepancies when it comes to patient care, communication styles. And that's actually one of the first problems that we are seeing. There is a direct link between miscommunication and poor patient outcomes. So that is something that is important to overcome. As as stated, patient outcomes, including safety and orders, are affected when miscommunication happens. For instance, if a patient comes in with a stroke, there are a lot of specialties that are involved in the patient care, including neurology, perhaps cardiology, PT, OT, pharmacy, and we have to be able to communicate effectively in order to provide proper patient treatment. It is our job as nurses to make sure that the patient outcomes is the most optimal possible in order for patients to have a better quality of life and improve. So it is important to overcome a lot of these barriers. Many times when it comes to orders and charting, different specialties may not match when it comes to orders. So it is, like I said, our job to make sure we clarify those problems. Barriers in communications are many. Among a few are lack of confidence, lack of experience, ego may be a problem, structural hierarchies, complexity of care, nature of distracting setting in the healthcare setting, and then lack of structure of the patient care. It is important to work towards overcoming these barriers. And there are many ways that we can do that, training being one of them. There has been a lot of studies that say that in the healthcare field, there has been a lot of advances in overcoming barriers when it comes to this by training at the same time or having workshops when on communication. Setting clear expectations from the beginning. So when a patient becomes admitted, have a conversation with the hospitalist, which is the person in charge of the entire care, and then also speak to the specialties such as cardiology or neurology. Set clear expectations. Also communicate with the people around you, PT, OT, delegating properly. Also, it is important to set a goal in order for everybody to be on the right page. So, overcoming interprofessional communication barriers is key to improving not only safety, but bettering the patient outcomes. Thank you.
So, to recap, the problem is communication in nursing. One of the ways we can address this is by having accurate and proper delegation to assistive personnel with clear delegation, teamwork, and follow-up. We can also improve it by talking to our patients and having good verbal and nonverbal cues, being open, honest, therapeutic communication, not being closed off. We can also use this with providers and interpersonal communication with providers, having no communication barriers, and being able to set measurable, achievable goals, as AJ was saying. Thank you for your time. Have a good day.